In the box next to me is visuals from inside a court in Bloemfontein where suspended ANC Secretary General Ace Magashule is set to appear in that controversial asbestos trial. In the meantime, experts have reaffirmed significant racial disparities in COVID-19 exposure. The evidence, they say, is in donated blood. In the test sample, about 80% of black donors had previously been infected compared to 40% of white donors. This covers the period up until just before the Omicron wave started, which was at the end of last year. Professor Alex Velter is an epidemiologist who partnered with the National Blood Service. Let's find out more. Professor, thank you so much for your time. A quick overview of the methodology of this study, what you discovered, and why it was important to undertake this study.
Right. So, we didn't know anything about Omicron at the time we decided to do this. But we knew that the Delta wave had come and gone, and we knew that some sort of resurgence eventually was going to happen. And we knew that the rates were currently very low in sort of October, November, and they were about as low as they'd been since the beginning of the epidemic. So there was a lot of immunity about after Delta, with the vaccination coverage, which was not ideal, but significant at that point. And so we wanted to get an idea of where things were at this point and where we had gone during the course of the Delta outbreak from the middle of last year. And so what's possible to do with the blood donor community, because they voluntarily come and give blood routinely in any case, you don't have to recruit them, you don't have to ask them, whether they'd be willing. All we do is ask for consent to participate in this particular type of research, which is no difference in terms of how much blood is taken from them. It's just a matter of how that is processed. And so what we did is we looked for antibodies, but particular types of antibodies. So these antibodies that were looked for in about 3,300 specimens that were collected in early to middle November, these are antibodies that people form in response to exposure to the live virus. These are not the antibodies that are formed in response to exposure to the vaccine. So we know that what we're measuring is not a mishmash of antibodies from those two sources. This is antibodies due to exposure to the virus. And when we say exposure, we don't mean you walk down the street and they're bounced off your nose. What we mean is they got inside and they triggered the immune system to produce some kind of antibody designed specifically against that pathogen. And so what we noticed is what you've summarized, that talking around numbers, a very large proportion of black donors had evidence of antibodies, roughly 80%. And roughly half that proportion, 40% amongst white donors. That's a pretty big difference. It's also important to point out that we have numbers estimated before the Delta wave, as I said, and we can compare those to what happened during the Delta wave. What's interesting is that we had a lot of differences between the provinces in early 2021. So Western Cape, Gauteng, KZN, Eastern Cape, Northern Cape, all very different. And those differences disappeared. And we saw those differences individually amongst white donors, amongst colored donors, amongst black donors, to the extent that we have enough data on each of those groups from all provinces. So it's really the white donors and the black donors that we have good data in all the provinces. And so the differences between provinces were very significant, and we didn't feel any surprise about that because the numbers reported were very different. But of course, we also knew that the efficiency of detection in each province is very different. So we didn't really know how to interpret that so well. But what we saw now is that after the Delta wave of the middle of last year, the provincial differences were largely squashed. And so that suggests, in some sense, that there's some kind of saturation, right? So, you could imagine they all eventually become almost 90% or something, but that's not quite what happened. So they became mainly close to 80% amongst black donors, and as I said, about 40% amongst the white donors. But the point about the saturation means that there is, with the pathogen that was available at that time, namely the Delta variant, there was some kind of limit being reached of who could get infected. And the flip side of that is the very, very low infection rates that we were looking at in October and November. So really, there was some kind of burnout at that stage. And that variant had gone as far as it could go. And until that immunity that had been built up was going to start waning, we were not likely to see another outbreak. But then along comes the Omicron variant, and we had a huge outbreak in November, December, January. And so that shows that, all bets are off when a new variant comes along, and that's an important message as well.
Professor, how can you definitively tell that the higher percentage of infection in black people is not because of biological factors? And if it isn't because of biological factors, then what is it indicative of?
Right. So, look, I mean, I think people like to harp on this, and this is South Africa, and so, a lot of people have different theories about what race means, but biologically it means almost nothing at all. So I'm not really aware of any meaningful biological category that's associated with racial group. It really is a sociological category. It's who your parents were, where you live, what you do for a living. I'm just not aware of any interesting, important differences between race groups that are of any biological substance. So, there are some things like exposure to malaria over many years amongst Africans and exposure to bubonic plague amongst Europeans. But these are very subtle things that don't really have any known significant effects on viral infection like we're seeing here. So it's really the social history that we are talking about. And obviously we have different living conditions, different working conditions that prevail in South Africa. I mean, we know this historically, and so this is really the only credible explanation for what the differences are.
So this is essentially down to inequality.
Absolutely. This is to do with, cramped living conditions, being able to work from home versus not being able to work from home, the elderly sitting at home in their suburban homes versus having to help run households past the age of retirement and so on. So these are the differences. Absolutely, it's inequality. There's no credible alternative explanation on the table that I've heard of.
What can be done with the data that you've collected? How can this be used moving forward?
Yeah, that's an interesting and complex question. And so first of all, I think what we need to do is get another round of data, which is collected, as soon as possible, now that we've had another wave of infection, to see what really happened with this change in variant. Did we get a significant change in sort of flushing out people who'd been out of the transmission network until that point in time or not? There is already good data on, whether infections were new versus reinfections of people who had previously had it. So then we begin to understand a bit better how durable immunity is with the passing of time, how it links to prior infection, and then that prior infection happened in the last 6 months or 18 months ago. So I think it's part of a puzzle by itself. It's one small piece of data to be connected with many others to understand whether we are constantly vulnerable to new massive resurgence or what the factors are that can kind of put the lid on subsequent waves, and what the key factors are that would help us, have those subsequent waves become smaller and smaller as opposed to a new sort of crisis every time. So we need to understand that. And this is a small piece of that puzzle.
Professor, thank you so much for your time. We appreciate it. Professor Alex Velter of the South African Center for Epidemiological Modeling and Analysis.